Okay. So, my observation in some patients is that they are so focused on their illness that they've lost their sense of their quality. And then what I hear is that when I can be freed of this illness, then I will live my life. And I know that to be not true. But can you expand on that a bit more?
Yes.
That it's your quality, living your
Yes.
quality, that actually frees you. You've hinted on that earlier, but could you expand on that a little bit more?
Okay. Go first again, like in other things, one sometimes has to change the words. Take away illness, because you will have the same process without illness. Millions of people walking around, doing everyday meditation, trying to reach enlightenment. And then they say, once I have reached enlightenment, then I will do this and that, and etc., etc. It will never come like that. So what does it show? It shows you that there is a deep inside wish for healing, if it's for enlightenment or from an illness, but at the same time there is a deep inside fear that I will never be what I in fact want to be. Mm-hmm. So in that case, the illness, as strange it may sound, can be a fantastic excuse, mm-hmm. not to say, well, I couldn't manage. Mm-hmm. That's the first thing. But the second, I think, much more important, now again related to the qualities. If I am aware of that more than body and mind, and if I'm aware that this is my potential, and if I'm aware, to saying in connection with dying, that which is more than body and mind, that atmosphere will never get lost, then obviously I don't need to fear dying. And now if you take it on to the level of an illness, then first enlightenment, then I don't need to run for enlightenment, because I say, what do I need to be enlightened? It's there. And the same is then with an illness. Whenever you focus too much on an illness, it means that there is a deep fear that you have not done what you wanted to do. And now the art is to learn the person to see and take the illness very seriously as a medical doctor, but also to show that each illness has a connection to your psychological state. Whatever illness is there, you have a feeling connection to it. But that feeling connection, again, is a limited part of your whole. So the art is to give them a balance between the illness, yes, which has to be treated in all the best possible ways, and that what they are more than that illness, because if you become totally identified with the illness, you have no chance. You can take as much medication and operations and whatever. That's what placebo shows.
Yeah.
It needs this other part which is more than you, and this balance. And you see in medical profession very often, out of the whole stress. I mean, if you are working in a hospital, you cannot start to say to the patient, okay, we have here your illness, but there is also this other part. You have to deal with the illness as fast as possible and go to the next. So, but that's the wrong way of how the health system works. The health system, every money which is accessible has to be put in education, in health, and in old people. What is our society doing? For example, Britain spends 1 million for one bomb in Iraq. How do you want that the health system can work? It's not possible.
Right, okay. So for the viewers of the program, can you give some pointers, say, if we can summarize in 3 points again, to help heal yourself, to be free from your illness, but more importantly, I think what you're saying is to live your life more fully. And you said just now also about to forgive is to cut the past experience. Now, that sounds easy enough mentally, and one can understand and grasp that, but how does one do that in practical terms?
I think in practical terms, every day, and I don't call it meditation, every day, every person should at least for 5 minutes stop being active. And stop being active does not mean you have to sit in a chair with crossed legs and closed eyes and all this thing. Just not doing anything changes the brain waves. The rest is rituals, techniques, belief, whatever. Just stop. And the stopping does not have to happen at home in a nice place. Just wherever you are, once a day, walking through Oxford Street or in your office, just stop and watch, observe what is happening. Like that, your consciousness, your brain, your body and your observer start to create an interaction. And it really doesn't need more than that. Mm-hmm. Because a lot of people, I understand, are afraid of all this meditation because one guru says that, the other says that, one says this way, and it also needs a lot of time. Mm. And people have not the luxury to sit around in meditation 3 weeks or whatever. So I'm saying it doesn't need a lot. Mm. Just create through a stop this connection between the different levels which are there, and even if you don't realize unconsciously, it starts to work. Mm-hmm. Now imagine you have the illness. People who have learned when the illness is there also to stop then for 5 minutes to detach from their illness. That's precisely then when the body, the mind, your energy has a chance to create new space, new energy, and something may, mm-hmm. There's never a guarantee, may happen. Mm-hmm. Mm-hmm. So to put that again in other words, at the end of the day, you see, I say it always this way. How do I care if there are 5 or 6 different consciousness levels? How do I care if this theory or this theory works or is correct or the chakras or all these things? At the end of the day, it's a question, can you love or can you not love? Mm-hmm. As earlier we learned people that love is not about oneself but being there in the world, as bigger their chance not to get ill without any guarantee, or to heal fast, or when the illness is there, to have, even if it's a terrible illness, to be able to deal with dignity with it. Mm-hmm. Mm-hmm.
So it's primarily, the attitude is hugely important here.
It's the most important, because mm-hmm. everybody will get sometimes ill, everybody will die. So the attitude, how you deal with life, mm-hmm. if it's another person or a situation or an illness, mm-hmm. is the most important. Mm-hmm.
Mm-hmm. Right, thank you. Thank you, Manuel.
Thank you.
Thank you for watching Conscious TV.